Hello and welcome to my channel. In this lecture, we will talk about common anatomical terms used in describing anatomy. So let's begin. First of all, the standard anatomical position. It's standing position with the arms, forearms supinated, means that the palms facing anterior and the thumbs pointing out and to the sides. This is the standard anatomical position. During the course of anatomy, we used different planes to describe structures. The anatomical planes are, first of all, the median plane, or commonly used as the sagittal plane. It's the plane that passes into the sagittal suture, and it divides the body into right and left halves. Of course, it passes through the cranium and the spinal cord. The sagittal plane, sometimes it's used for parasagittal sections, parallel to the median plane. The frontal plane, or the coronal plane, it's a transverse vertical plane also, and it divides the body into front and back, or anterior and posterior. Sections parallel to the frontal plane called paracoronal, or simply called coronal sections. It doesn't have to be passing into the coronal suture. The horizontal plane, it's a transverse plane dividing the body into upper and lower halves. It's perpendicular to the other two plane and is parallel to the ground. Axis of the body, we have the anteroposterior or dorsal-ventral axis or sagittal axis. We have the cephalocaudal or craniocaudal caudal or longitudinal axis, and we have the dorsal-ventral axis, or the horizontal or frontal axis. Each axis describes the locations of structures like anteroposterior and cephalocaudal. Cephalo means closer to the cranium, caudal closer to the lower end or to the tail of the animal, and the dorsal-ventral, dorsal at the back and ventral at the front. Several terms are used as prefixes. Like, for example, sub indicates something that is beneath, like the subscapularis, for example. It's beneath the shoulder muscles. Hypo indicates something also that is beneath, like the hypochondriac region. Hypochondriac region means that's beneath the ribs, like the stomach lies in the left hypochondriac region. Infra used to describe something that is within or below, like the infraorbital structures. Infraorbital nerve, for example, it's within the orbit and opens below the orbit. Inter means in between. For example, the intercostal muscles run between the ribs. Super or supra means above something else, like the supraspinatus, for example. It's above the infraspinatus. We have the suffixes added to the end of words, like the ad and ab. For example, distad means distal direction, and It means beyond the, for example, distal of the femur means beyond the femur in the distal directions. So ad means towards, and ab means away from something else. The main terms used, like superior, inferior, for example. Superior describes something that is above something else, and inferior describes what's below it. For example, the stomach lies superior to the intestine, the small intestine. Inferior means below something, means, for example, the uterus lies below the intestine or inferior to the intestine. Anterior and posterior describes, anterior is what's in front, and posterior describes what is to the back of something. For example, the stomach lies anterior to the kidney, while the kidney lies posterior to the stomach. Medial and lateral, that's referring to the midline. Lateral away from the midline or away from the body, and medial means structures close to the midline. For example, in a human, the arms are lateral to the torso, the genitals are medial to the legs, for example, if to describe these terms, lateral and medial. Terms derived from lateral, like contralateral, for example, means the opposite side. The right half of the brain controls the contralateral side of the body, means controls the left half of the body. Ipsilateral means the same side. For example, the left arm is ipsilateral to the left leg. Bilateral means on both sides of the body. Bilateral orchiectomy means removal of testes on both sides of the body. Unilateral means only on one side of the body, like a stroke in a brain hemisphere can result in weakness, or unilateral weakness, meaning weakness on only one side of the body, and usually, of course, the contralateral side. Varus and valgus, used to describe a state in which a part further away is abnormally placed towards varus or away from, we use the term valgus. So varus is towards the body or towards the midline, and valgus away from the body. Like, for example, the position of the elbow. If the forearm is close to the body, it's a varus type. If the forearm is away from the body, it's called the valgus type. Proximal and distal. Proximal and distal used to describe parts of a feature that are close or distant from the main mass of the body. For example, the upper arm in humans is proximal, and the hand is distal. Central and peripheral. Central describes something close to the center of the body, like the central nervous system, for example. Peripheral describes something that's further away from the center of the body, like the peripheral nervous system, the spinal nerves, and the cranial nerves. Superficial and deep describe how close a structure is to the surface. Deep is away from the surface, and superficial means near the outer surface of the organism. For example, in skin, the epidermis is superficial to the hypodermis, for example, or subcutis, for example. Dorsal and ventral, these terms are used more commonly in embryology, describing the embryology. The dorsal surface of an organism refers to the back. The ventral surface refers to the front of an organism. Also, cranial and caudal. We use it also in describing the brainstem. Because the brainstem is oblique, it's not straight vertical, so you can use superior and inferior with comfort. But because of the position of the brainstem, superior, when using the term superior, usually confused with dorsal, and inferior confused with ventral. So that's why we use rostral and caudal, or cranial and caudal. Rostral or cranial means closer to the head, and caudal means closer to the lower end. This makes description of structures more precise. Hands and feet. Of course, the palm surface of the hand faces anterior, and the dorsum of the hand faces posterior. So the palmar aspect or structure is more palmar than the other, means it's closer to the palm of the hand. Dorsal means closer to the dorsum of the hand, like the dorsal venous arch, for example, is on the dorsum of the hand. Sometimes we use the terms radial and ulnar. Radial means closer to the radius bone, and ulnar means closer to the ulnar bone. The same applies for tibial and fibular. Antiversion and retroversion. Anti here means with an E, means forward. Retro means backward. Antiversion means rotated forwards, and retroversion means rotated backwards, like the position of the uterus. Normal position of the uterus is antiverted, anti-flexed, as we studied before in the pelvis. In pathological cases, the uterus may be directed backwards. So in this case, it's called retroverted uterus. It compresses the posterior nerves or the sacral plexus. So this is antiversion and retroversion. Other directional terms. Axial means around the central axis of the body or the extremity. Luminal means in the lumen or the cavity of a hollow inside an organ, in the lumen of the stomach or in the lumen of the intestine, for example. Parietal means pertaining to the wall of the body cavity. For example, the parietal peritoneum is the lining of the inside of the anterolateral abdominal wall cavity. Terminal means the extremity of a projecting structure. For example, an antenna with a terminal sensory hair. Visceral or viscous means organs. So the viscera applies to the GIT, for example. The stomach is a viscera or a viscous. The intestine are viscera or viscous. Any organ inside is called viscera or viscous. And the nerves supplying such organs are called visceral nerves. Aboral means away from the or opposite to the oral cavity. Describes a location along the gastrointestinal canal relatively closer to the anus. That was a recap of the terminal of the anatomical terms used in anatomy, describing anatomy of the body. I hope you got the maximum benefit from this lecture, and thank you very much for watching.